Hey everyone, thanks for coming. We really apologize for the replacement, but thank you all for coming today. So just a short introduction for those who did not attend the last week. This week it will be on Dr. Siba's lifestyle medicine. So I'm Dr. Selina. I'm the founder of Medic Footprints Malaysia. We are a platform where we build this community of doctors where we take care of each other, and we are a platform that connects doctors to various career fields, diverse careers in any fields that you want. We aim to show doctors that you don't have to be stuck in just clinical medicine in the hospital to be purposeful, to help people, to even to treat patients. So I hope you get something out of today's session. I'll let Dr. Siva introduce himself and start. Dr. Siva, you can start your presentation.
Hello, everyone. Happy to be with all of you here today. My name is Dr. Siva Kubalasingham. I'm the president of the Malaysian Society of Lifestyle Medicine. And the Malaysian Society of Lifestyle Medicine is affiliated to the Lifestyle Medicine Global Alliance. Okay. I'm also one of the exam writers for the board examination. Okay, without carrying on too much about what I do, let me share about what lifestyle medicine is, and then let's talk about the evidence supporting lifestyle medicine. And then I'm going to share a couple of cases that that I myself have had experience with in my own practice, and then maybe we'll have a short discussion. Okay, all right. Now,
actually, Dr. Siva, you can also share like how you stumbled into lifestyle medicine. I think that was a very interesting story that I think a lot of our attendees might relate to as well.
All right, sure. Okay, let me just stop this first. Okay, so well, when I initially graduated, let's say that would have been 1991, all right? And so I was very much straight-laced medical doctor. So I decided to actually graduate in, do my postgraduate in ONG. So I had done my part 1 MRCOG, and then I went to Ireland. I was in Dublin, and I was actually doing my posting there to get my training for the part 2. So while I was there, that was my first sort of introduction to complementary medicine, because there was this massage school that needed someone to do anatomy and physiology lectures, very basic. And for some reason, my professor said, okay, can you go and do these lectures for these guys? So I said, okay. So, I mean, it was just a job. So I just went and I did the lectures weekly. And, in Ireland, everything revolves around, social drinking after the class, because they're all adult students. So they used to chat about, they were all from the complementary medicine field, and they used to chat about complementary medicine. And I wasn't particularly interested, okay, but I mean, I would just sit there and listen to them and, that sort of thing. And anyway, towards the end of my tenure with them, the lady who ran this college wanted me to visit her practice, which was just on the outskirts of Dublin, and I had kept postponing it because I had to make that trip. So I thought, well, out of courtesy, let me just make this visit, and so I went, and then I was very astounded. I mean, this was actually one of my sort of the turning points. So there were some patients there, and one of the patients was actually a child, and the parents were telling me, an Irish child, and the parents were telling me how this child had eczema. And so the parents were telling me how he has improved tremendously. And when I looked at him, he was like 30–40% covered with eczema lesions. And they were telling me that he had actually about maybe 70–80% of his body was covered with eczema. And so they were very happy to that, whatever this lady by the name of Elaine Shaw had done, she was actually a trained nurse, had helped him. So, well, I said, okay, that's great, but it's not that I immediately got interested in complementary medicine. So while I was there, she wanted to do one of these energy medicine testing. They had a device, and she said, can I run this test on you? I said, well, okay, why not? I'm here, let me do it. So she ran it, and then, as I said, I just lecture, and we have maybe a social drink, maybe a chit chat with the group of students. But I mean, she wouldn't know what I'm intolerant to or what my health issues are. So as a medical student, I had very severe gastritis due to the stress, and I had to have a scope, etc., and I had erosive gastritis. So there's no way she would have done that because by then all this was settled. I had no issues with my gastric; it was all under control. And I had a couple of things that I couldn't tolerate well. Like for example, I can't eat. At that time, I used to eat mutton, but I couldn't eat very oily food. I used to find it a little uncomfortable. So the device picked all that up, and I said, okay, that's a little strange. It's a little bit interesting. So then she said, sometime down a couple of days later, she said, there was this guy, doctors from Germany coming down, and they were going to run a program, a training. Would I be interested to have a look at the device? I said, yeah, why not? Because I was a little intrigued with the device. And the long and the short of it is, I went for the training. I decided to buy the device, and then I begin to have thoughts like, okay, do I really want to do ONG? Because I found this very interesting. But then I also felt, and now I'm talking about like 93, 94, when complementary medicine, lifestyle medicine, these were all not sort of big here, and was just beginning to grow in Ireland. So I said, and then I discussed with my parents. I said, I want to come back, and maybe I want to rethink what I want to do. So of course, you can expect that my parents were extremely unhappy about that. I said, okay, I mean, I'll go back after 1 year and I will complete it if this doesn't appeal to me. So somehow they agreed. I came back, I freelanced for a while, and as I saw patients in the clinics, and then I talked to them about changes they can make. For example, a child that comes in frequently with flu, or what kind of diet they should eat, etc., what supplements they should take. And I found that, yeah, they stopped coming to see us repeatedly, all right? So I said, okay, this is for me. And then I decided to set up a practice. But initially, it was an allopathy-based practice. And I used to do complementary, this more nutritional medicine, etc., ad hoc. And from 2003, then we are completely an integrative and lifestyle medicine-based practice. So initially, we used to do a lot of nutrition medicine and mindfulness. That's what we still do. And I did lifestyle medicine, but I didn't have a name that was attached to it. So, and sometime down the road, I was doing this online course with Harvard. So Harvard has an Institute of Lifestyle Medicine, okay? So as I was doing this, then I began to see that there's a lot of things about lifestyle medicine. And then I found the American College of Lifestyle Medicine, and I was quite interested in what they were doing. And I realized that whatever I was doing was actually put in a structure. And the other thing that appealed to me was that it was all very evidence-based. And then with this evidence-based, there's a lot of protocols that were there. And then I decided to do the board exams. By then they had introduced the board exams. So the journey of the American College of Lifestyle Medicine also took some time. I think they set up maybe in the early 2000s, 2002, 3. So there were these guys from Harvard, and they felt that there's something not right with what we were doing, because we are so advanced technologically, and yet we are not able to combat chronic diseases, but actually the reverse is happening. So they begin to ask themselves, okay, what's wrong with what we are doing? Why is it that we are not able to, to deal with these issues when we have so much of advances? So they felt that one of the core areas that maybe we are not doing, though we may know about it, is that we don't really coach our patients. We don't teach them how to do lifestyle change. All right. So it's a very general, okay, take care of your diet, eat less fat, eat less sugar, eat less carbs, go and exercise. Then if you're hypertensive, go and manage your stress. But how do you do it? And you realize that for patients to make these changes, a lot of hand-holding is important. How are you going to effect this behavioral change? How are you going to create this awareness? Because you must understand something. The patient these days is no longer the patient of, let's say, the 60s, where medicine is practiced in a paternalistic fashion. That means I'm the doctor, I tell you, and you do what I'm telling you to do, right? So the patient actually, in reality, is only going to make the change if the patient has an awareness that, yes, I'm not going to get better by just popping some pills into my mouth. And I'm here today because of what I did to my life. And unless I can change that, I cannot actually reverse or manage my disease well. It doesn't matter whether I'm going to take herbs or nutritional supplements, or I'm going to take drugs. It doesn't matter. Okay. So these are the things that lifestyle medicine emphasizes on. All right. So then we decided that, okay, let's share this with Malaysian doctors and the Malaysian public. So we decided to set up the Malaysian Society of Lifestyle Medicine, right? So we conducted our first board exams last year virtually. We were actually supposed to have our inaugural conference last year, but that didn't happen because, because of all the issues with COVID. And I'm pleased to let you know that we had 100% passes, the number of candidates that sat via Malaysia. All of them passed because we held some coaching sessions for them. So we were the only center in the world that had 100% passes, And okay, maybe what I'll do is I will start sharing with you about lifestyle medicine, and maybe if you have any more questions that you want to ask about my journey, or how we go about practice, we can discuss that later. And I will start talking to you about lifestyle medicine. Okay, Selena, are we all right about that?
Yes, I think it was good.
All right. Okay.
Thank you.
Okay. So according to the Global Burden of Disease study done in 2010, there's been an epidemiological shift in morbidity and mortality from infectious disease and malnutrition to NCDs. And the rise of NCDs, okay, has escalated the cost of healthcare, which is world over becoming unsustainable, right? Now, we all know, okay, why we are in this state today, right? The first thing, of course, is diet. So we're going to have a diet which is high in simple sugars, simple carbohydrate, a lot of fats, saturated fats, a lot of trans fatty acids, okay? And then let's talk about exercise, okay? So these days, our exercise, has reduced, and I think the only thing that we exercise, let's say we exercise enough is our fingers when we use the tablet or the handphone, all right? But, basically we are very sedentary, okay? And most people suffer from a chronic lack of sleep. So your lack of sleep, of course, also increases the cortisol levels in the body. Then I don't need to tell you that worldwide, we are also facing a stress epidemic, and it's of course compounded with the COVID now, okay? And then smoking, all right? Smoking is a big risk factor, not only for lung cancer, but also for atherosclerosis and arteriosclerosis, okay? So studies show that if a person decides to stop smoking today, today is the 29th of May, 2021, in 1 year, with no other change in lifestyle, by 29th of May 2022, they will be able to reduce the risk of heart disease by 50%. Okay, and alcohol, right? Excessive alcohol use also increases the risk of chronic diseases. And then social isolation, right? So human beings need to be socially connected. So social isolation decreases longevity, all right? Increases the risk of mental and emotional issues, right? Okay, and and when I say social connection, we mean like being socially connected in person. It's not just being on your Facebook or on social media, because studies show that the increased use of social media actually increases the risk of depression and anxiety, and the people that use these social media the most have the most amount of risk. Okay, so if looking at Malaysia, if you compare between 2007 and 2017, okay, nothing much has changed. Dietary risk remains the risk factor that drives death and disability the most, okay? Then followed by high blood pressure, smoking, and then diabetes and obesity, right? We just exchange places, and then high LDL, okay? So all these are the same factors that we know that lead to chronic diseases. Okay, now Margaret Chan was the Director General of WHO for 2 terms, and during her second term, all right, they released the World Health Statistics. One was in 2013 and one in 2015. So what happened in 2013? 63% of the world had NCDs and were And then 2 years later, it went up to 68%. Then in 2017, we had a new WHO Director General. And what happened here? All right, so we have a change in the leadership, but what's happening to our NCDs? The NCDs are escalating. Now 70% are dying due to NCDs. So if we look at Malaysian Statistics, okay, so this is the National Health and Mobility Survey for 2019, okay. So if we look at diabetes, overall prevalence is about 18%. So 2011, 2015, 13, okay. Hypertension remains stagnant, overall prevalence 30. High cholesterol has come down somewhat at 38%. Now, 50% of our adults are either overweight or obese, okay, an increase compared to 29% in 2011 and 30% in 2015, okay. And let's look at children, right? 30% of our children are overweight, okay. So basically, we are grappling with a huge amount of lifestyle issues. Okay, so the National Health and Mobility Survey just confirms the numbers, right? And then let's look at the risk factors that lead to these diseases. Okay, let's talk about exercise. 25% of adults are inactive, okay, as compared to 35% that were not active and 33% that was not active in 2011 and 2015. And let's look at intake of vegetables and fruits. Almost 95% of adults do not consume the recommended amount of 5 servings per day, right? So which is more or less the same in 2011 and 2015 is 92 and 94%. So poor dietary habits, okay, and sedentary lifestyle, okay, and smoke, and of course we have a fairly large number of people who still smoke, but there has been some amount of improvement in the number of people who consume alcohol or binge drink. Now, what is good and what is sad is that 80% of lifestyle diseases can either be prevented, managed, or reversed. Now, that's the good news. But what's the sad news is that unfortunately, we're not able to make that impact on the population or on our patients effectively, right? So one of the objectives of MSLM is that we want more doctors to embrace lifestyle medicine. It doesn't mean that people who embrace lifestyle medicine are completely going to be practicing lifestyle medicine, because fundamentally, lifestyle medicine becomes the base of any disease, any treatment that we offer. So having a proper knowledge and having a proper approach to how we counsel the patient and how we can then help to impact this behavioral change, because it's not the latest drug in diabetes that's going to help. Because if it's the latest drug in diabetes that's going to help, we won't be having a 1 in 5 prevalence rate. Okay, we've gone up from 1 in 10 to 1 in, our prevalence now 1 in 5 as compared to 1 in 10 about 10 years ago. Okay. So what is lifestyle medicine? It is an evidence-based therapeutic intervention that promotes 6 core pillars. Okay, so one is nutrition, where emphasis is on a plant-based diet. Okay, regular physical activity, where the physical activity is tailored or is advised according to what the person needs. So that means if a person wants to lose weight, then the amount of physical activity and the type of physical activity will be different from somebody who has a normal BMI, but it's just has a sedentary lifestyle. All right. Then we talk about emotional and stress management and emotional and mental wellness, how avoidance of tobacco and moderate alcohol use, positive social connectivity, and good sleep. Right. So let's talk a little bit about the 6 core pillars. So nutrition, it doesn't mean that we advocate people to become vegetarian. Not everybody can be vegetarian, but we advocate a plant-based diet. Why are we talking about a plant-based diet? Basically, I just showed you 95% of our population do not eat the recommended amount or the 5 servings per day. So what we advise people is that they should take half, this is called my plate, and half the plate should be fruits and vegetables, and quarter of the plate should be proteins. And we advise that plant proteins should be incorporated as well, and whole grains. Now, along with the plant proteins, people can eat meat or fish, all right, whatever they like. But that should be used more as a condiment, because if meat is going to be predominantly the food that they eat, so where are the vitamins and minerals that we need? Where's the fiber going to come from? Okay. Now, the reason why plant proteins why we advise them to take a lot of legumes, or why it's advocated, is that because plant proteins or legumes have 30% of their composition is fiber. So it's a food that gives you high fiber. Taking a lot of fiber not only helps you with the general things that we already know, prevents constipation, helps to bring down cholesterol, helps to regulate your blood sugar, but it's also been shown that it can produce short chain fatty acids in your intestine, and these short chain fatty acids help to produce something called butyrate, and this plays a significant role in managing metabolic diseases. Right. So Dr. Stanley Khan and his colleagues, right, state that nutrition is the most important single environmental factor affecting health. And many scientific literature support that high consumption of vegetables and fruits are protective for both um, for cardiovascular disease, diabetes, cancer, etc. Right. Now let's go on to exercising. So one important thing that we must understand, and that our patients must understand, is that you can't out exercise a bad diet. So I have patients who very diligently will walk up Gusing Hill. Okay, they've got a walking group. So they walk up Gusing Hill and then they come down, and then near Gusing Hill, there's this popular banana leaf restaurant called Raju's. So they'll go to Raju's, have the roti chana and their teh tarik. So I tell them, you can't do that. When you're doing social walking, let's say once a month you get together and you do that, it's okay. But you can't do it on a daily basis. Okay, so if you're going to have a bad diet and you're going to exercise, uh, well, the result is not going to be what you expect. Okay, so when we talk about exercise, what we want, what we teach, or what we want people to understand is that you need to have three components to exercise. You need to have your aerobics, you need to have strength training, and you need to do flexibility exercises. And this becomes very important as one ages. So starting flexibility exercises earlier in life, the earlier you start, the better. But nevertheless, if someone is older and they start, it still improves their flexibility. And that becomes important to prevent falls as you grow older. One of the biggest reasons why the elderly fall is because, one, they start losing their flexibility. Once they start losing their flexibility, their hip stride becomes smaller. When the hip stride becomes smaller, your stability is impaired. Okay, so doing this making sure that these three components are incorporated into the exercise is important. Then managing stress, right? So stress, of course, leads to a host of diseases, both physical diseases as well as mental disease. It also compromises our immune system. So various methods like mindfulness, all right, yoga, Tai Chi, all right, Qigong, and of course, exercise does help to manage stress. So depending on what the person needs or what the person can do, we should be prescribing this appropriately. And if a person is not able to do it, or they don't know how to do it, well, we've got to teach them how to do or send them somewhere where they can be taught. Right? So we've already talked about smoking, right? And same with alcohol. I mean, alcohol, no binge drinking. So though technically 2 drinks per day for men and 1 drink per day for women is allowed, but it's important to emphasize to patients that no binge drinking. So you cannot say that I didn't drink for 5 days, so I haven't used 10 of my drinks. So today is Friday, I can then take 10 drinks. Okay, that is actually harmful. Okay, now sleep. Okay, one is number of hours and the time of sleep. Okay, so well, basically everybody knows 6 to 8 hours of sleep is what we need. The other thing is that a person should sleep between 10 to 11, right? And that's when a lot of restorative mechanisms kick into place. Growth hormones released at night. Okay, so if you disturb our rhythm in the body, that's going to lead to health issues, right? Then we talk about social connectivity. So one interesting study that was done is called the Harvard study. So this started in the 1930s or 40s. So they looked at Harvard male students. These are considered the privileged group. And they compared them with inner city Boston men. These are the guys who are rough and tough and they don't have much going for them, right? So they followed them up for 70, 80 years. And this is one of the longest running studies. And what they found was that what contributed to happiness and longevity was not their education or their wealth or their career or their jobs, but actually it was social connectivity, right? So this is another important aspect. And actually, as Malaysia begins to sort of slowly move into the aging, countries or the aged, where we have an aging population, it's very important to address this because um, a lot of the people who are aging, all right, are lonely, all right, so this compromises the health. Now, there's another type of social disconnect, okay? Youngsters who are always on their gadgets, okay? So they are not actually connected emotionally to people, right? And they don't know how to deal with people. And this actually also extends to, in fact, I was sharing with Selena and Vivek the other day that some medical schools are saying that when the students have completed the year 1, year 2, and they go to the clinical years, they're not able to engage with patients. All right. So these are all some issues that need to be addressed. Okay. So let's talk about some of the doctors who were the front runners in lifestyle medicine. So one of the earliest people to get into this was Dr. Dean Ornish. Okay, at that time there was no specific name, but he was practicing a lifestyle lifestyle medicine. Okay, so he has now published a lot of research. Okay, so one of the research that he published showed that comprehensive lifestyle changes, okay, encompassing the areas that I talked about, can actually affect our gene expression. It actually helps to turn on, all right, disease-preventing genes, or can turn off genes that promote cancer and heart disease. He also collaborated with Nobel Prize winner Elizabeth Blackburn. She and her team, or a couple of other colleagues, were awarded the Nobel Prize for their work on telomeres. So telomeres, I think you all know that they are the caps on the chromosomes, and the longer the telomeres and the more active your telomerase, the enzymes, okay, this promotes longevity. Shorter, then it reduces longevity, increases risk of disease. So they also showed that lifestyle change can actually lengthen telomeres, right? So the study on telomeres, right, was actually done on men who had low-risk prostate cancer, and was a 5-year follow-up study published in Lancet Oncology. And they found that lifestyle intervention helped to increase telomere length. Okay, and this is the heat map that shows pre and post upregulated genes and downregulated genes. He also, another study done by him that's been published is the Lifestyle Heart Trial. It was an RCT, and again, lifestyle intervention, where basically he promoted a plant-based diet with low fat, exercise, stress management, smoking cessation, group psychosocial support, social connectivity. And what he found was, this was published in JAMA, and there was no regression of coronary arteriosclerosis that after 5 years, then after 1 year in the experimental group. In contrast, the group that did not participate in the intervention, all right, or the control group, had more than twice as much cardiac events, right? Another doctor who went into lifestyle medicine, as I said, way before it was like structured and called lifestyle medicine, was Dr. Esselstyn. And this was an image of one of the earliest patients that he had in the mid-1990s. So this was actually a colleague of his. So this colleague was feeling unwell for some time, and then they could not kind of identify what was wrong with him. And finally, he had a myocardial infarction. And then if you look at the diseased artery, that was his angiogram at the time. So he was recommended to have a bypass. So he knew that Dr. Esselstyn was working on something that was a little different. And so he and his wife came to talk to Dr. Esselstyn, and they said, okay, why not? I'm going to give this a shot. I've got nothing to lose. Now, after 32 months, the post shows an artery that has reversed the occlusion. Okay, so this was one of his earliest patients. And he's also published in Journal of Family Practice, where patients with significant coronary artery disease, those who adhere to a whole food, WFPBD is whole food plant-based diet, right? They 99% avoided major cardiac event, and 93% the angina improved as compared to those who were non-adherent participants. 62% experienced an adverse event. Okay. All right. In the United States, they actually ran a large study called the Diabetes Prevention Program, right? So they focused on healthy eating using my plate and physical activity, right? So the goals of that program was 7% body weight loss and 150 minutes of exercise weekly. So they had a lifestyle coach who could help them with a behavioral change, who would work with, will meet them once a week, all right? They come in a group setting, right? And what this study found was that people with pre-diabetes reduced the risk of developing type 2 diabetes by 58% and 71% for people over the age of 60. And there was also an RCT done with lifestyle intervention, metformin and placebo. And what the study found, which was published by Nola in the New England Journal of Medicine, was that lifestyle intervention reduced the incidence of progression to diabetes by 58% as compared to 31% for the metformin group. So what should we be doing to our patients that when we find them to be pre-diabetic? We should be actively introducing lifestyle intervention, not starting them on metformin. I'm not against metformin, but I'm saying look at the data. What we are doing is we are not doing what we should be doing. You see, we expect the patient to change lifestyle without actually coaching them. And in my practice, I found that it is not only about the level of education. Okay, they may be very educated, they could be CEOs, etc. But when it comes down to the nitty-gritty of what they should eat, what they should do, well, I guess they need to be taught. It's just like, okay, I can use the laptop, I can use some programs, but if you ask me the nitty-gritty of IT, I'm not going to know unless somebody teaches me, right? Okay. All right. Now, this is just to share with you a couple of my own patients. This was a 37-year-old Middle Eastern man who presented in November 2019. He actually came to see me for social phobia. But when I saw him, even though he's presenting with the problem of the mind, but, he's obese, he's 107 kilos. And, well, I can't just look at the social phobia and ignore the fact that he's obese and he's probably predisposed to a host of things. So, when I asked him, have you done some profiles? He said, no. So we did some profiles, found that his HbA1c was 11. What's his diet? He only eats carbohydrates and meat. And if you ask him why, when I asked him why, he said he didn't think about it, why he doesn't eat vegetables and fruits. He didn't think about eating that. That's not part of his culture, you see, and no exercise. Now, this guy is a very intelligent, very diligent, and he's very sort of structured. His lifestyle is very structured. So when he comes for consultation, he'll actually come with a book. And if he doesn't understand what I'm saying, he will write in Arabic, he'll go back and he'll check. So anyway, he implemented whatever I advised. He switched his diet. It became predominantly plant-based, started eating oats, he started exercising an hour a day. And of course, he was treated with yoga for anxiety, specific pose to help him shift so that the amygdala in the brain is not overstimulated, okay? And basically, when you do yoga for anxiety, depression, and all that, it's basically then you are helping the necessary serotonins or dopamines and the GABAs to balance back, reducing the activity of the amygdala, increasing the activity of the left brain. Now, why am I saying all this to you? Because all this has been shown on neuroimaging. So that's why mindfulness, etc., has become extremely popular, particularly in the West, after the neuroimaging showed that when you do this pre and post as early as 12 weeks, you can see changes. Okay. Now, by the end of February 2020, his social phobia is gone. His weight has dropped to 90 kilos. His HbA1c has come down to 5.8. Now, 2 months ago, his weight is 78 kilos. He's maintaining his HbA1c at 5.6. And very importantly, he's got 3 young children. And as as we went along this journey with him, he realized that, yeah, I should also be doing this for my children, and got his children start eating oats. Of course, you need to, one thing is that in lifestyle medicine, you learn is that that's why you need to spend time with your patient, and you need to make the food palatable. So he also told me, after 3 months, he said, "Doctor, one thing I learned is that from you is that eating healthy does not mean it's not tasty." Okay. Now, another patient is again is an 18-year-old girl presented with anxiety in August 2020. She has a family history where father is diabetic, who had a myocardial infarction, stroke. The patient came in obese with a BMI of 34. HbA1c was 6, so she's actually pre-diabetic. Okay. Again, same thing. They came with anxiety, but because of the family history and because of the fact that when you look at her, she's obese. So then, talk to the mother, said that, maybe it's good to also look at the profiles, look at the BMI, look at her as a whole, not just treat for the anxiety, right? So her eating patterns are very irregular. They study late into the night, so sleep at 3, 4 o'clock, get up at 12, have breakfast or lunch or whatever you call it at 12 or 1, and then maybe another small snack at night. But in between, I think she snacks, okay? And a lot of the food is grab food, because recently the father had a stroke 2 years ago. He's bedbound, and I think their lifestyle has, kind of hasn't settled back. Just no exercise, a lot of sleep, okay? Um, no exercise, sorry, a lot of stress, and a disturbed sleep pattern. So after lifestyle intervention, which included yoga for her anxiety has improved tremendously. All right, she is now doing very well where anxiety is concerned. And we also prescribed exercise where she did walking, and we also did dynamic yoga and specific courses for her obesity, and diet modification. She's adapted predominantly plant-based diet. So her change we started was, you see, this is an 18-year-old young girl. Now, if I tell her, you stop your grab food, you can't have grab food, that's and just can't keep ordering food from outside. So we started with, okay, why don't you change the rice? You order your dishes, you change the rice. Okay, so straight away she went and bought brown rice. Then after that, it was like, okay, so you're already ordering, but they're going to give you very little vegetables. So why don't you make a salad? And you say, oh yeah, I can cook tauge, and then she will cook some dishes and she'll share it with us. So by April 2021, her BMI is now 29. Okay, so she's moved from grossly obese to she's almost at the borderline of getting into the overweight zone, and her HbA1c has come down to 5.7. So 5.7 is now borderline diabetes, pre-diabetes. Okay. So as I said earlier, I'm from the Malaysian Society of Lifestyle Medicine. So we are affiliated to the Lifestyle Medicine Global Alliance. As I mentioned earlier, so the initial people who set this up was the Americans. So they called it the American College of Lifestyle Medicine. But as in the around 2010, from then onwards, the American College began to grow. Okay, more doctors were interested. And along the way, people from other countries got interested, and people began to set up their own societies. And they felt that, okay, we don't want it to be so Americanized. We want it to be more of a global movement. So we set up the Lifestyle Medicine Global Alliance, where societies from around the world. There are more than this right now, but these were some of those that were initially there. And from Asia, we actually have Philippines, Korea, Japan, India, Pakistan. All right, these are also countries that have now set up societies and are affiliated to the Lifestyle Medicine Global Alliance. Right. Now, I'm pleased to let you know that we'll be hosting our inaugural Malaysian Lifestyle Medicine Conference on the 4th and 5th of December 2021. And of course, initially, when we started talking about it and things were getting better, we thought that we could do an in-person conference. But the way it looks like now, I doubt that. So it's going to be a virtual conference, right? So please keep in touch with Medical Prince, who will be, who will work with us for this conference. And if you have any further, if you need any further information, you can also visit our website, right? So in conclusion, lifestyle medicine is a promising modality to combat the rise of chronic disease and also improve the quality of life and reduce the cost of healthcare, and most importantly, it can be used alongside all modalities of treatment. Okay? Right. So let me end with a quotation from David Katz. He was the past president of the American College of Lifestyle Medicine. So he says that lifestyle medicine is both the newest thing in medicine and perhaps the oldest. There was a time before medicine when lifestyle was it. So Hippocrates advised that food be thy medicine, and we have found our way back to the future with good reason. Okay. All right. So would anybody like to ask me any questions?
Hi guys, if you have any questions for Dr. Siva, definitely ask him now. It seems like this lifestyle medicine thing is a very new concept here in Malaysia. You know, I feel like when I was a when I started housemanship, like, you know, when you write all this prescription, okay, reduce like sorry, not housemanship, during like my MO-ship in the clinic kesehatan. So when I'm trying to advise all this patient, I get so many of these NCDs, like very badly controlled diabetes. You're giving them all the OHAs, you're upping all the insulin, but nothing seems to work. And then in the plan, I just write, oh, advise patient on diet control. That was it. So after that, I actually don't know. I don't follow up on, oh, what is the diet control? What should I advise him? And then they come back a week later, a month later, and say, no, doctor, I changed my diet. You know, I eat very little rice. I exercise or I walk 3 times a week, but then their weight went from like 80 kgs, 90 kgs, 100 kgs. Then the HbA1c is also increasing. And at that time, I was just very baffled. Like, when they ask me, what can I do? And then I realized, oh, actually, I don't know how to advise them. So I think this is a very, very interesting thing. Perhaps, you know, anyone in the audience, if there's anything you want to ask, maybe you can just raise your hand and speak into the mic or type in the chat. So, Dr. Sibat.
There was a question posted. I think Pearly Yen has asked for the 3 components of exercise, right? So I'll just answer that. So that's aerobics, right? And then strength training and flexibility.
Right, Dr. Siva, how about when, say for instance, I'm a medical graduate, I graduated already, and then I started housemanship, and then I didn't finish. Can I still practice this lifestyle medicine?
Okay, that's a good question. All right. Now, if you have not completed your housemanship and you don't have your full registration with the MMC, yes, you can practice lifestyle medicine because it's just counseling about lifestyle intervention, right? But there are some areas that you cannot get into. For example, then you cannot tell your patients what medicine, you cannot get involved with their medication, all right? And you cannot do things like drawing blood, all right? So these are some small areas that you should not get involved in because you're not technically registered, because that may cause a lot of issues. But otherwise, just counseling a person on nutrition and exercise and doing mindfulness with them, that's not a problem. Okay. Let me see.
Okay, someone asked how to go about it if without the APC. How do they go about it, practicing this lifestyle medicine?
Yeah, okay. So maybe what I can do is, can I share one pathway that we can talk about, all right? And then maybe after that we can discuss again, all right? So, and then I'll come back. I think there are a few questions there, but I'll come back to that. Let me see the questions. Hold on.
Okay, so you want to go to the other questions, is it, Dr. Siva?
No, I'm going to move my slide. I'm going to talk about the board certification, all right?
All right, sure.
Okay, just hold on. Okay, so one pathway to getting some accreditation in lifestyle medicine, because you see, let's say, all right, you decide you want to practice lifestyle medicine. You're gonna just say, okay, now I know I have knowledge about lifestyle medicine. In fact, when I did the board certification, I learned a lot, even though I was already practicing some type of lifestyle medicine. I was doing nutritional medicine, but there's still things to learn. All right. So one aspect can be one way is or would be doing a board certification in lifestyle medicine. All right. Now this certification comes from the International Board of Lifestyle Medicine, and it can be undertaken from a clinical or a public health perspective. All right. So I will share with you about the clinical and the public health perspective. So why do you want to certify? Okay, basically you're going to learn how to prevent, manage, and reverse chronic diseases, like what Selena rightly pointed out, and what it's the same experience I had when I worked in the government service before. You find that you're not able to impact much because you've got so many patients, and also other than the basic knowledge, we also don't have the in-depth knowledge at that point, to make a significant change. Like at that time, I wouldn't have been able to confidently tell patients, come, let's try and see whether we can manage your diabetes or your pre-diabetes. Like now, when I see people with pre-diabetes, I tell them, okay, just get on with the lifestyle intervention. This is a good time to find out that you have a problem. So I always tell patients, pre-diabetes is a good stage where you find out that you have a problem instead of being diabetic. We can easily reverse it, no issue. It also helps you to enhance your knowledge in lifestyle medicine and improve your competency, and teaches you how to coach your patient to effect the behavioral change, how to create awareness in patients that they need to change, how you put the responsibility of change and managing the disease back in the patient's hand. See, it's got to be a partnership between us and the patient. It's not so much where the patient comes and says, okay, what medicine next? Because what medicine next business does not work. Okay. Now, the types of certification, all right. Now, one is for doctors. So whether you have an APC or you don't have an APC, as long as you're a doctor who has graduated, you should go for the certified physician. Okay. Now, those who have master's or PhD level and they come from other disciplines, including dentistry, right? They will be called certified professional. Okay. And now people who have like a degree level, say for example, a pharmacist or nurses with a bachelor's degree, right? They will be eligible to do the certified practitioner program. Now, the requirements vary by their professional status. So now all of them have to do a 30-hour online CME, which is self-directed, and there are a few courses that you can take, but the one that is actually geared most towards the board exam is actually the lifestyle medicine board review course. Okay, because it tallies quite well with the examination. So if anybody wants to do, I would suggest you do that, because if you go and look, there are a few other courses that can be done even on our website, right? And you need to have an in-person attendance at an approved program, for example, like a lifestyle medicine conference. So the easiest way would be to attend a conference that MSLM organizes or workshop. And I'm also pleased to let you know that MSLM is one of the approved CPD providers approved by MMA. Okay, so those who want to get some CPD points, and we're holding a program, okay, if you join the program, then you can also get a CPD points. And then so A and B is for those who are certified practitioners and certified professionals. So for doctors, you need to do a case study of your experience with lifestyle medicine. So it's not very difficult. The template is provided. Okay. So basically, you need to talk about the patient, what the patient's problem was, and then what kind of lifestyle intervention you did, and then what was the outcome, and then your conclusion. Okay. And of course, when you write, there must be some referencing. Okay. Right. And then the exam itself is a multiple choice. So for doctors, it's 150 questions, 4 hours. For other professionals and practitioners, it's 120 hours, and the duration is, sorry, it's 120 questions and duration is 3 hours. Okay. All right. So let me look at the questions and see whether I've all right. So would it be possible to have a private practice of lifestyle medicine without APC? How do I go about it? Okay. So I think Taran, I've answered that question. All right. Pearly, you want to know about the fees, huh? All right. So the board certification exam, right? Once you're a member of MSLM, your fee will be US 1368. If you're not a member of MSLM, it'll be US 1498. All right. Now, please register with MSLM because the pricing for the exams are tiered for Asia. All right. So tier 1 is for developed countries like Singapore, Korea, etc. Now, if you register in the US portal, it will be immediately the US rates. Okay. Now, then the course itself is US 499. And then, of course, our conference fee, we haven't actually fixed it, but it will be less than 500 ringgit. It will be quite cheap lah. All right. So we haven't actually worked out the online rates because we were, even in person, we were looking at 499 because we want to encourage more doctors to attend the conference and to get a feel of what lifestyle medicine is. Okay, so LMDRC is 499 per lead. All right. And then, okay. Okay, so who's this anonymous attendee? Doesn't have a... Okay, anyway, I'll just answer the question.
So this guy wants to know, after you've done the board exam, like how do you practice? Is it as a GP or a lifestyle doctor specialty, or how does it work?
All right, basically because you this person asked me about, so I'm not very clear. If you are a person who has an APC and you're running a general practice, so you can run your general practice and it can be, you then focus on lifestyle medicine. It depends on how you want to practice it, all right? But if you want to just have a practice that's purely lifestyle, then it's a lifestyle medicine practice. Okay. Now, if you have an APC, then you're free to practice as a doctor practicing lifestyle medicine. But you don't have an APC, then it is more that you will do counseling. So you cannot do, there's some restrictions. Okay. And per lead is US 499. The earlier rate is also in US. All right.
Okay. Any other questions, guys? Just keep it coming. Because I know of a lot of people who, they just really want to treat patients. Like they enjoy that whole connection, that connection with the patient and
yes,
and really helping the patient. But in the context that we are doing right now is in the clinical setting, in the hospital just per se. It's crazy because patients, when they come to the hospital, it's already like late stage, right? So to reduce all this burden on the healthcare system, those that come in late stage, we have to find those guys who are still in the early stage where we can still do something. So I think this is a really, really good way of really helping ease the burden of the healthcare system in Malaysia and really improve the quality of lives for patients and also doctors in turn, because you are actually really nipping things at the bud, instead of just symptomatic treatments with medication.
Yes, to answer the other question that's been posted, is health coaching part of the syllabus? Yes, it's part of the question. It's part of the syllabus for the examination, and it's also covered in the course. All right. Yeah, actually, adding on to what Selena was saying, you would find lifestyle medicine actually a very fulfilling discipline. Okay, it doesn't matter like if you maybe are practicing something else and then you just incorporate, because you'll find that you will be able to see more changes in the patient, and you will be able to see that, very importantly, your patient is adapting a healthy lifestyle, So Azwa, Dr. Azwa, I think you said that you are doing the modules on LM for Inspired Medics, but I think it doesn't cover your requirements, right? Maybe a part of it, and then I think they are linked to BSLM. I just happen to see that. So if you're going to do the board exam, I haven't really looked at the complete module on Inspired Medics, but I would suggest that if you're going to do the board exams, do the Lifestyle Medicine Board Review course. But I think they're affiliated to BSLM, so maybe you can see whether there's some exemptions, etc. Because if you don't do the right module, what happens is that the question gearing will be from the, because I'm actually one of the exam writers for the board exam, right? So I realized that I mean, basically we follow the module quite tightly. Okay. Okay, so I think I've answered that. All right, so we are planning to maybe have an introduction. We're planning to have, let me get the next slide on. And it's also a very interesting feel as you go on, because you will realize that you are able to impact a lot of young people. A lot of young people have a lot of issues, and you can make a significant change. Like I mean, what Selena was saying. See, instead of waiting till they all end up in, you see, like the 18-year-old girl. Well, basically, if she follows her pattern of living, well, by the time she's 30, she's probably going to have diabetes, right? You know. Okay, let me try and get. I can't get the next slide up. I'm going to stop and I'm going to start that again. Okay, so we're going to be having an introduction to lifestyle medicine, a short course, right, in late June, early July. And if you're interested, you can join us for that. You can explore some of the modules and see whether this is something that will appeal to you. Okay, and what like Dr. Azwa, once you've signed up, when you're doing the exams, we actually run some coaching for the candidates. Okay. Okay. To answer the question about are you able to make a living practice lifestyle medicine full time without APC? Yes, as I told you, you can practice lifestyle medicine full time, but you stick to the counseling part. Okay, and your career options will be quite good. In fact, there are many wellness centers. There are many set up by this property developers, and then they don't know what to do with the centers, so they just have some massage and some gym, and then this is like a $1 million, $2 million setup. So if you guys are all trained and you can actually incorporate this with them, you have a good potential, and also you'll be able to also impact even if you set up your own practice. But as I said, again, if you don't have an APC, stick to the parameters of what you can do. Okay. Yes. So to answer Gan, if you're a house officer now and you will apply under a certified physician. So maybe Selena, those who are interested, maybe you can get them to talk to me if they need more information.
Okay, sure. Sure, I'll get them to everyone. I hope you're are signing up to our mailing list. I'll just drop our website here, and then there's a join the community button. I hope you all sign up. I mean, you can click the join the community button and then sign up to our mailing list, because I make sure you tick like you agree to sign up to our mailing list, because that's where we send out a lot of info about the latest courses, all the preferential rates that Medic Footprints are getting, and all the job opportunities. It will be sent out through our mailing list. So I hope you'll sign up to it. And if you have any extra questions on on this lifestyle medicine, I think you can just drop me an email at selena@medicfootprints.org. I will send my email here. Okay, you can send me an email here, and then make sure you're signed up to our mailing list. Okay. Is there any other questions that you would like to ask Dr. Siva? Maybe we can have more a more thorough session with Dr. Siva, like a proper introduction to lifestyle medicine. So those who are interested, I mean, we will send out the emails, and then you all can just sign up to it. I think that would be a good start. Would you say, Dr. Siva?
Yeah, I think that'd be good, because sometimes you're not sure whether you want this is for you and you want to commit to it, you know. So we are running this introductory course so that you can explore it, get some basic knowledge, okay. And if you're practicing, you can try it out. And if you want to sign up for the board exams, etc., then you can do that later, right? So that'd be good. So if you have any question, send your email to Selena. She'll forward it to me, and maybe drop your contact number as well, because sometimes it's easier to explain instead of having to write long responses. Okay. All right. So send it to Selena, then she'll be in touch with me. All right. And then you can visit our website if you want more information on lifestyle medicine. All right. Okay,
All
guys.
right.
Thank you so
Okay.
much for attending this session, and I'm very happy.
Sorry, actually, there's one last question. World Coaches US is affiliated with American College of Lifestyle Medicine. Is that a better course than the board course?
Okay. Well, Well Coaches is involved in the coaching aspect. So the coaching aspect of that's done for lifestyle medicine, okay, is done by Margaret Moore, and she's from Well Coaches. So now they've also got some accredited programs from Well Coaches. But if you want to do a lifestyle medicine, if you want to be a lifestyle medicine practitioner, then if you do what Well Coaches is doing is only one aspect. So it would be better to do, I'm assuming you're a doctor, so it'd be better to do the LMBRC because you don't need that what Well Coaches is doing per se, because part of that is already in the course. And then do your exams.
Okay, guys, I think we will just have we will plan for a more thorough session. I guess 1 hour may be a bit short, so maybe a more thorough session where Dr. Siva can really explain more and give all the other option. You know, like for instance, I think this is very good question. Like, you know, you compare the other course with this lifestyle medicine course. So guys, if there's no more questions, then I think we can end for today. Thank you all for coming. I hope you all had some takeaway from this. And thank you, Dr. Siva, for spending your morning with us. And I hope to see you guys soon. Make sure you're subscribed to us at www.medicfootprints.org/Malaysia. And you can also drop me an email at selena@medicfootprints.org. So hope to see you guys in our next month's webinar. Take care.
All right. Thank you, Selena. And thank you everyone for attending. See you all. Bye. Have a good
Thank
weekend.
you.